My first question is your full name.
Elvin Glenn Zook.
Okay. And where were you born and when were you born?
I was born on March 21st, 1937, the first day of spring, on a farm near Huntington, Indiana.
Okay. And your parents' names?
Ruth Zook was my mother. Glenn Zook was my father. He died when I was 4 years old following a hernia operation. He had a pulmonary embolus.
Wow. Okay, so you basically were raised by your mother then?
My mother and my grandparents.
Okay, okay. Were they, when you were born on in the city, farm? Or?
Farm.
Okay, all right. So you grew up doing farming?
Grew up doing farming. Cut weeds with a hoe when I was hardly big enough to hold the hoe.
That's hard work. How many children, grandchildren, you don't have to name all, grandchildren, children, and great-grandchildren?
I have 3 daughters. One's oldest is an OB gynecologist. Second one is a pediatric nurse, and the third one's a plastic surgeon. And I have 7 grandchildren, 4 boys and 3 girls.
Okay. And the plastic surgeon, she practiced in Illinois? Or
yes, practices at Southern Illinois University.
Okay, where
I practiced,
okay.
or where I did practice.
Right, right. And your other 2 children, do they live in Illinois also?
Well, yes, they did. My middle daughter's husband is in the FBI and is in Washington, D.C. for a year and a half of special training. But so they'll probably come back to Illinois after that.
Okay, okay. Your wife's name and how did you meet her?
Sharon, Sadie Hawkins at college. She asked me out because she had a boyfriend that wasn't paying much attention to her, and she thought she'd make him jealous. And I told her that I'd take care of her problems. Well, I probably gave her more than I took care of, but that's how we met.
You have to tell people what the Sadie Hawkins dance is.
That's where the women ask the men out.
Yeah. See, I'm old enough to know that. What inspired you to go into plastic surgery? If you'll tell us a little bit about your mentors that brought you here to this day.
Well, I went to medical school and had an externship in Lafayette, Indiana, when there were a lot of orthopedists there, and I got interested in orthopedics, and I was going to be an orthopedist. And someone told me that what I should do would take a rotation with the plastic surgeons in Indianapolis and learn how to close wounds and make better scars, and I'd have the best orthopedic practice there was. So I got set up with Dr. Thomas Bauer, who was on the faculty at Indiana, was in private practice, and to spend my off quarter in medical school with him. And after about a week, I decided that's what I wanted to do. I didn't want to break those bones and do all that.
Okay, so that's what got you interested in plastic surgery. All right. Look, you've seen momentous and changes in paradigm shifts in plastic surgery during your career. Tell me about some of them things that just were tipping points or sentinel things in your life, in the plastic surgery life.
Well, I think, when we really started out, there were lots of things we couldn't do a lot for. And over the years, we developed doing more and more better hand surgery, new techniques in this and that. Cosmetic surgery has developed and has become more and more a part of plastic surgery. I think that, my interest has always been in developing things and doing things that were somewhat different than what others had done in the past. And I think if I look, for example, when I went to Springfield, Illinois, to Southern Illinois University School of Medicine, there were 4 plastic surgeons in Illinois below I-80, which runs just south of Chicago. 4. Today, there are 12 in Springfield. And there are almost 100 in downstate Illinois. So that's a paradigm shift. And I think we do a lot of more things than we did then, but I think we do them better, and the general surgeons and other people did them a little bit, and we kind of took over a lot of them and developed them.
It's important innovation in our specialty during your practice and even beyond.
Well, I think there's been some developments in cosmetic surgery, but I don't think that has been as much as reconstruction of the breast, the various techniques, the use of microsurgery and replants. I think those two things have done more for society probably than all the other things that we've done.
What's the greatest mistake our specialty has made?
I've been thinking about that since you gave me the list, and I don't really think we've made very many mistakes.
Okay.
I would say maybe putting too much emphasis on cosmetic surgery, but you know, I don't know that that's a mistake. It keeps a lot of people making a living so they can do other things. But I think that's important. If you use something to pay the bills, you can afford to do the other things. It's when you only do those things that pay the bills and you don't give back anything to society that becomes a problem.
What do you think your greatest professional accomplishment has been?
Professionally, I think the things that have happened in the various organizations I've been in, for example, American Society of Plastic Surgeons, used to be the American Society of Plastic and Reconstructive Surgery, and I was instrumental in getting the reconstruction left out because the otolaryngologists really made a push to add plastics to their name several years ago, and we were able to stop that. And I wanted to make a specialty. Everything we did was plastic surgery. Even the reconstructive surgery was plastic surgery. So I think that was one thing. Big changes in the board examination. When I was chairman of the board, we eliminated the.
What year was that? I want to interrupt you because
it was about 20 years ago.
Okay.
And anybody that has ever taken a re-exam will appreciate getting rid of the re-examination, because when you took two exams and you knew you didn't do well on one of them and had to take a re-examination, people were so frightened that it was almost impossible to do a good examination of them.
Okay.
I had a young woman one time that came in for a re-examination, said she had to go to the bathroom, and she went into the bathroom and wouldn't come out until we slid the questions under the door and coaxed her out, and she took the examination. She was just petrified.
So this was part 2 of the exams, the oral exam.
Oh, the oral exam.
Yeah, okay.
Yes.
Yeah, okay.
And she passed.
You just had to coax her out of the bathroom.
That's right, I had to coax her out of the bathroom.
That was your job.
And I said, if I ever become chairman of the board, we're going to eliminate this.
Now, how do you eliminate the re-examination?
Well, we just took the score. We gave 3 examinations, 2 unknowns and 1 on your cases.
Right.
And if you could fail 1 of the 6, if you failed 2 of the 6, then you were failed.
Right.
There was no re-exam. You had to come back next year.
Oh, no re-exam at that sitting?
Yes.
Ah, okay. Yeah, you would have to take a re-exam, but you weren't allowed to come back in and go over it again. Now, and just again, because it's interesting to me, why did you feel a re-exam at that sitting at that time was not as good as making them come back and sit again?
Because they were so panicked after knowing that they had not done well earlier in the day to bring them back and do it again. I can remember giving examinations until 10 o'clock at night, and we had already given about 10 during the day, so you can imagine you probably weren't as alert on your 10th examination as you were on your first one. And I don't think it was fair to the person because they didn't get a good re-examination.
That's a good point. Okay. What's been your greatest joy?
Well, I think my greatest joy has been the people that I've operated and taken care of, and the people that I've trained. It's one of the nice things about living in a city the size of Springfield, is about 125,000, and operating on the people in Southern Illinois. You know, I hardly ever would go out to dinner, but somebody would come up and tell my kids how great a job I had done on taking care of them. And I don't think you find that very often in New York and Chicago. And the other thing was, when I went to Springfield, I interviewed and I went back to Indianapolis, and Dr. Bennett, who I was on the faculty with, asked me what I thought, and I said, I'm going. And he said, you're going to Springfield? There's nothing there. And I said, that's why I'm going. And now there are 12 plastic surgeons in Springfield. And at that time, there were 4 south of I-80. So, you know, plastic surgery has grown. Plastic surgery in Southern Illinois has grown. People don't have to go to Chicago and other towns to get their surgery. They can have it done there. And I think that's something that I feel very proud of contributing to. And the people that we've trained that are practicing around the country.
Now, on the other side of that, I would like to know what your greatest professional disappointment was.
Well, I've given a lot of thought since you gave me the list, and I don't know. I guess it would be the people that come in that I can't do anything for. That would be one thing. Another would be that I've never been the president of the American Association of Plastic Surgeons.
Okay.
A lot of other things, but never that one.
I would like to know who you admire most, in professional or personal. And you can mention more than one person if you want.
Well, I admire Dr. Bennett, who was my chairman and trained me. Have a lot of respect for him and what he did. He trained a lot of people that went into academic medicine and became teachers. I have a lot of affection for Harold Kleinert, who I spent time with as in hand training in Louisville, Kentucky, who recently has passed away. And Dr. Paul Brand, who you may or may not know, was in India and did hand surgery for leprosy in India.
Yes.
Self-taught, never had a day of surgical training, was in India, and these people came in with terribly deformed hands, and he just started operating on them. And was a fascinating man. I was at a Hand Society meeting and had dinner with him in New Orleans several years ago, and listening to him talk was just unbelievable. Blew me away.
All right, I'd like your words of wisdom for present and future generations of plastic surgeons.
Do the best you can in everything that you can. You know, don't cut corners. Don't say that's good enough, because there is no such thing as good enough. It has to be the best you can do. And the other thing is, don't let the economics of what you're doing and the people that you're operating on affect what you do. If some woman with no money comes in and wants a facelift, that's one thing. But if somebody has a hand injury or any kind of an injury, professionally you should be obligated to take care of them if you're asked to take care of them.
And you could talk a little bit about your retirement. I know you've been active, but your words of wisdom for retirement, be interested to know what you've been doing.
Well, I think if you have something to do with the training program, if you can keep a little bit going. I have a board review course that I have for the residents, and I quiz them and do that about once a month or oftener. That keeps me in, keeps me knowing the residents, keeps me a little attached to plastic surgery. Other than that, I spend a lot of time with my wife. I have 2 farms, and I don't run the tractor, but I plant trees and cut trees and do all kind of the grunt work on those, and I seem to keep busy.
So what predictions do you have for plastic surgery in the next quarter century?
Well, I would hope that we would keep advancing the specialty. There are still problems out there that are unsolved, and I think it's important that we keep research going, keep looking for new ways to do everything. Don't become happy with what we're doing and stop and not develop it, because we can always do it better. And do the best that you can. if you do shortcuts to cut down time and don't do the best, then we're not doing what we should be doing.